Some Americans say ambulance China is free.
My wife has given birth here in the Chinese hospital. It's a private Chinese hospital and it's amazing.
Ni hao!
This video is addressing the most asked questions from Americans to Chinese on Xiaohongshu concerning the healthcare system.
What's China's healthcare like?
How much is healthcare in China? I just had a dental surgery. I had to cut out the nerve from my tooth and cut the gums to relieve pressure from an infection. I have to have a root canal and some more surgeries done, but it's going to cost me like $7,000. That feels like a lot, but I'm just happy to have the pain relieved. But how much does dental care cost in China? How does your healthcare system work? Just wondering.
Ni hao. I am from the United States. I am a nurse. And I want to know, what is healthcare like here in China?
New friends from China, I have a question because I just got home from the doctors and I didn't actually get to see the doctor. I went for my yearly appointment and they decided not to take my health insurance and sent me home. And they said none of the doctors take my insurance. I just wanted a little checkup and they were like, you're gonna have to pay hundreds of dollars out of pocket for that. So I want to know, does that ever happen in China? I have no idea how the healthcare system really works in non-Western countries. I want to know, would that ever happen? And what do you guys think about our health insurance? Do you equally think that that is just as crazy as I do? I need to know.
On this basis, we are going to make a comparison between the healthcare system in America and in China. I'm saying America generally and in China. And through this video, we are going to be also clearing some misconceptions that have been going around concerning healthcare in America and also in China. So stay tuned, like the video for recommendation, subscribe, and also share your thoughts in the comment section. If there is a question that is raised here, kindly, if you have an answer, type it down there.
你好，熊是我的名是Bryn，谢谢你的热情接待。I'm so sorry if I messed that up. I am trying really hard, but I am making another video. I know I've seen Chinese users be surprised about Americans making multiple videos per day, so I just want to apologize for doing that. But I'm very excited to help bridge the cultural gap of knowledge and experience between Americans and the Chinese population. Today, I have seen a lot of Chinese people express surprise and a lot of myths regarding the way that Americans live. So one of the first things that I want to address is healthcare. It seems a lot of Chinese people think that we have free universal healthcare. We do not have free universal healthcare. Healthcare is a big issue here in the United States. It is very expensive. We pay hundreds of dollars a month just to have healthcare. On top of that, we still have to pay whenever we go see the doctor. We have to pay for ambulance rides. Ambulance rides are typically $1,000. We have to pay out of our own pocket. Insurance will cover a portion of that, but not all of it, so we still owe that money. I had to get an MRI for my head and my neck and my back, and that was $17,000. My insurance covered $15,000. I still had to pay $2,000. I want to let you guys know I am $4,000 in medical debt. I have chronic illnesses that I need a lot of treatment for. I pay $200 a month for my insurance and I'm still $4,000 in medical debt. I owe so much money and still pay to get my prescriptions. Some of my prescriptions are over $100 a month. I have to pay to go see my doctor. I have to pay for specialist visits, for treatment, for x-rays. It's ridiculous. A lot of Americans don't have any health insurance. And in America, if you get cancer, you oftentimes end up bankrupt and in hundreds of thousands of dollars of debt. A lot of people do not get treatment for their cancer because it is expensive. And there are a lot of insurance companies here that will just deny your treatment. They will not cover it because they think it's not necessary or they don't think you need it. They just don't want to pay for it. That is one of the reasons that Luigi Mangione shot the United Healthcare CEO. I see you guys love Luigi Mangione just like we do, but we are not free. We say that we're free, but we are not free. Everything is expensive. We cannot get healthcare. We can't get the healthcare we need. There are not enough doctors. It is too expensive. If you have any questions, please comment below. I will do my best to answer them. And again, thank you so much for letting me be here.
Some Americans say ambulance China is free. No, it is not. Ambulance in China is chargeable. It used to be free, but free use brings the problem of abuse. Someone caught a cold, call ambulance. Someone is late for school, call ambulance. It resulted in the occupation of public resources. So ambulance start charging. Take Shanghai, for example, which is the most expensive city in China. There are two types of ambulances: emergency and non-emergency. Emergency is the main topic today. They are called through phone number 120. There are total 7 charging items, namely ambulance fee, waiting fee, pre-hospital first aid fee, medicine fee, material fee, examination fee, and treatment fee. Ambulance fee is 30 yuan per trip, including 3 kilometers of mileage, equivalent to $4. 7 yuan per kilometer after exceeding the mileage, equivalent to $1 per kilometer. Waiting fee is 80 yuan per hour, equivalent to $7.25. First aid fee is 80 yuan each time, $7 if needed. Other charges such as treatment, medicine, material, examination is almost the same as in the hospital. A typical charge of one emergency ambulance is about 200 to 300 RMB, equivalent to 30 to 40 US. Non-emergency is usually for discharged patients with limited mobility. Phone number is over here. It charges a little higher than emergency, but not too much. Last but not least, emergency ambulance is covered by medical insurance. Now you have a better understanding of China's ambulance charges. Which opinion do you think is better for the society? Free or not free? How much does ambulance cost in your place? Leave your comments. Follow me and learn more about China.
I can't even believe this. I was taking a nap and my phone just started going off, so I was like, okay, I normally don't get text messages this frequently. So I got up to check to see what the messages were. I got 2 messages. One from my Plan D Medicare insurance, which is my the insurance that pays for my medication, and then one from my doctor's offices. My Plan D insurance already takes out $100 out of my SSI a month. That's on top of the $200 that Medicare also takes out for my Plan A and B, which is like my doctor's offices and my hospital bills. So it's already $300 that I get taken out of the $1,200 that I get a month to live. And I knew that there were like cutbacks and shit when it comes to, I'm literally getting emotional, when it comes to insurance, like Medicare and SSI and stuff. But like I was like, I set it up so the Plan D would take out of my SSI payments before I got it, so I didn't have to worry about it when budgeting, because I get paid one time a month and I have to budget everything so specifically so I can like make it through the month, because I'm not getting another payment for another 30 days. WellCare, the insurance company I get my medication through, my medication insurance through, just sent me a text message saying I owe them $38 more, which means I'm supposed to pay them $138 a month on top of the $200 that I'm already paying. Plus, this insurance doesn't cover as much of my medication. So my medications, each of my medications used to be $1 and change a piece. They're now $5 and change a piece, and I'm on like 5 or 6 meds, and I don't know how much all of them have gone up because I've only gone through one refill on this new medication. And then on top of it, my bill for my my PCP appointment, just one appointment, was $50. So now my Part A and Part B, which I'm paying $300 for, isn't even covering. It used to cover the entirety of my fucking doctor's visits. And now I have to pay $50 every single time I go. It's like $47 or something. And at the end of the year last year, I got a bill from the hospital for every single time I went saying I owe them $400 because insurance just decided not to pay $400 even though I pay them $300 or $200 a month, however much I pay a month. I get $1,200 a month total. They already take $300 a month out of what I make. I am living off of $900 a month. I can barely pay for everything I do. I have to budget so specifically for everything just so I can fucking live. And I'm already spending so much money on other things to manage my fucking symptoms because I'm in so much pain all the fucking time because they don't actually fucking help me. And now they're coming in and saying, oh, now every single time you have an appointment, every single month, we're also going to charge you this much money. When...
What's up, everybody? I know there's been a lot of questions about healthcare lately. What's it like getting healthcare in China? I got a little ear infection, so I'm here at the hospital to show you what that looks like. So here we are, walking into the hospital, and I'll let you know how this whole process goes. I'm gonna hang a number. Walk in here and give them your ID. Get a number to see the doctor, depending on the department you'd like to go to. All right, I got my number. It's about $2 US, 15 renminbi to get this. And now I gotta go find the ear, nose, and throat department. This thing right here, you just scan the number. You've got a ticket. There's wait in line. Waiting about 15 minutes. The doctor took a look, confirmed my ear infection, paid just now another $12, and time to go get my ear cleaned. Ryan, quick 3-minute ear cleaning. Now I'll go back to the original doctor, see if I need any medicine. So it looks like I need to get some medicine, some ear drops. That'll be about $1.50. And the pharmacy is just on the first floor of the hospital. So I'm gonna go get that medicine, come back upstairs, they'll apply it for me, and should be a done deal. Okay, medicine in hand, go back upstairs, talk to the doctor one last time. And with that, we're all finished. The entire process took me just over 1 hour, maybe an hour, 10 minutes tops. And the grand total was 114 renminbi. It comes out to about $15 US and 50 cents. I come back once a week to have them put on the medicine. I don't think that's gonna cost anything. Maybe an extra $2 each time. At most, and we're good.
Hey TikTok refugees, welcome to Xiaohongshu. My name is Jeff. I'm a dermatologist. I've been back in China for about 3 years. Previously I was at Harvard. Today let's talk about the difference in healthcare between China and the US. One of the first things that I realized when I came back here is that the hospitals here, there are so many people. The first time I went to the hospital, there were probably a few hundred people outside waiting. I thought it was a concert hall, but no, it was a medical center. The ratio for doctors to patients here is about 1 doctor to 1,000 patients. In the US, it's about 1 doctor to 400 patients. So the doctors here are extremely busy. They often have to work from morning 7 a.m. to nighttime 8, 9 p.m. without much time to even have lunch or even go to the bathroom. Number 2, too, even though the hospitals here are so busy with patients, it is very easy to get an appointment with the doctor. If today you were feeling unwell and wanted to see a doctor, all you have to do is open your phone, go to the Alipay app or go to your WeChat app, and you can directly make an appointment for a doctor that morning to be seen either that afternoon or that evening. There's no such thing as a 2-month, 3-month, or even 6-month wait. And number 3, let's talk about the cost of healthcare here. Here, to see a dermatologist, the average cost is around 15 up to 30, 40 RMB. Roughly translated into USD, that is around $2 to $5. So it is very cheap. In the US, if you don't have insurance, the cost to see a doctor might be in the couple hundreds, if not a few thousand range. But here in China, healthcare is very cheap. I had a friend who had a kidney stone, went to the ER, got a CT scan, got surgery done, was recovering for about 1 to 2 days. The total amount he spent was just a few hundred USD. So TikTok refugees,
Guys, I've had fever for 2 days and have to go to hospital today. Many of you asked me about the healthcare system in China, and I guess today I can be your tour guide. So here we can go to any big hospitals without reservation or clinic reference letter. To see a doctor, I only need to scan my medical QR code and pay a consultation fee of $1. My doctor suggested me to do a blood test. Altogether, 9 tests cost $36 before insurance and only $9 after insurance. Once the blood test was done, wait for half an hour, I could then get the test result from printing machine. Luckily, it's not flu, so after getting some medicines, I can go home and rest.
Let's talk about healthcare in the US. I'm in China right now. I broke my Achilles and I've been going to the orthopedics for the last month. And the healthcare system in China is insanely good. It shits on the US. Let me just tell you a few points. An MRI in China is around $200, $300 US. I think in the US it's 10 times that price, if I'm not mistaken. I've been getting MRIs left and right. Yes, I have really good insurance, but I can pay out of pocket if I needed to. Another thing is, it's so efficient here. You get here, you're taken in. There's no waiting. In the US, you're filling out forms, you're waiting 30 minutes, right? In the doctor's office, there's no waiting here. I've been at 2 hospitals today for two different things. Seamless, easy as I get there. Then with WeChat, you can message the doctor directly. If I need to schedule an appointment, if I need to get a prescription, I just message them on WeChat. It's way more efficient than emailing, calling. It's even better than WhatsApp. It's just so seamless, the technology, and you can do everything through there direct.
My name is Emily. I'm a Canadian living in China. Today I will show you how efficient and affordable it is to see a doctor in China as a foreigner. Prices for X-rays, ECG, and blood tests included. I made an appointment on my phone last night using just my passport and was able to schedule an appointment at 9:30 a.m. this morning. I arrived on time and waited for only 10 minutes until my name was called. I told the cardiologist that I'm here for a regular heart checkup and she sent me to an ECG, blood test, and X-ray. Here are the prices I paid as a foreigner without any medical insurance. Still very affordable. Then I got my ECG done, no need to wait at all, and I got the results on the spot. I then waited 5 minutes to get my blood test done. Results will be out in 2 hours. Next was X-ray. I waited for 10 minutes and results will be out in 1 hour. I had all of the tests done in 40 minutes. The fact that you can do 3 different tests and get all the results on the same day of your appointment is crazy. Also love that they have everything digital. You can make appointments, payments, and check the results all on your phone. Everything is just incredibly efficient and affordable at the same time. Let me know your thoughts on the Chinese healthcare system in the comments.
Chinese hospitals can cure fainting. So before I lived in China and I was living in Guowai, whenever I get a 血脂检查, I always faint. Super embarrassing, super awkward. But Chinese hospital fully cured me. So in Guowai hospital, it's kind of stressful. You walk into this room, there are like 3 nurses waiting for you. There's like 1 to hold your hand, 1 to give you a cookie, 1 to actually draw your blood. And dude, 3 ladies looking at me at the same time, I get 无太恐惧症. But today I went to a Chinese hospital and dude, I swear there were like 3,000 people at the same time queuing to draw blood. And it was crazy how fast they were getting through everybody, right? A26到5号窗口才去 A27 A28 A29 finally gets to me A250到8号窗口才去 So I go over and I tell the nurse, look, I'm sorry, I often faint when drawing blood, can I please lie down? Bro, I swear, she gives me like this look and she doesn't tell me, but she tells me with her eyes. Like in socialism, there is no time to 惯着有后毛病. Rolled up my sleeve, I stuck out my arm and I thought about Kanye West's new 老婆 and I was ready to faint. I accepted it, I was gonna 晕倒 But dude, she was so pro. 10 seconds, she was done. Bro, I swear, I yapped.
Why Americans are choosing China for combined traditional Chinese medicine and Western treatment? Why? Because it works and it's affordable. Here's the reason. Firstly, in China, acupuncture, herbal medicine, and physical therapy are paired with advanced medicine treatments like surgery and diagnostics, creating a holistic care plan catered just for you. I can give you some example. One of my friends, after battling breast cancer. She combined some chemotherapy with traditional Chinese medicine therapy for immune support and faster recovery. What's the result? Fewer side effects and quicker healing. It's a fraction of the cost compared to the States. I can tell you the benefits. Firstly, is affordable care, 70% on treatment costs. The second is faster access, no long wait time. Three is a comprehensive treatment, traditional Chinese medicine plus Western medicine working together. So if you're ready for a health transformation, just contact us. Thank you.
Hey guys, I'm Anna and I'm studying traditional Chinese medicine in the United States to become a doctor of acupuncture and herbal medicine. And I was thinking about posting a video series about the stuff that I'm learning as a way to help me study and also a way to share with you guys what I've been learning lately. And so I have an idea for a video series where I post herbal medicine, guessing what the herbal medicine is that I'm talking about, or maybe guessing what the Chinese medicine diagnosis would be for a certain patient with certain symptoms. So let me know if you think this is a good idea and if people on this app would enjoy that. And also let me know if you have any ideas about what kind of stuff you would want me to post on this app. All right, thank you. Bye.
The trend of Americans seeking dental procedures in China is rapidly growing, driven by factors such as affordability, high quality care, and advanced technology. Here's the why China is becoming a preferred destination for dental surgery. 1. Significant cost savings. Dental procedures in the States can cost up to 3 to 4 times more than in China. For example, dental implants in the States can cost you like between $3,000 to $5,000, whereas the same treatments in China average just $1,000. 2. World-class expertise and technology. Many top dental professionals in China have been trained internationally, and Chinese dental clinics are equipped with cutting-edge technology. In fact, 90% of dental patients from the States reporting being satisfied with the quality care received in China. 3. Efficient and timely service. In China, wait times for dental consultation and treatment are significantly shorter compared to the States, where patients often face delays of several months for elective procedures. This efficiency is a key reason why many Americans opt for China treatment. 4. Its a comprehensive dental tourism package. Medtrip China offer all-inclusive package, including surgery, accommodation, and even sightseeing, providing an attractive option for those seeking both treatment and travel. In conclusion, the combination of cost-saving, top-tier medical expertise and efficient service is making China an increasingly popular choice for Americans seeking dental care. If you want to know more, just directly message me. I'll give you more options. Thank you.
Hey everyone! After spending some time on Rednote, some of you might be wondering, how much does it actually cost to travel to China? And how much would it cost to get a dental work done here? Well, let's take it up a notch. What if you could do both at the same time? How much would that cost? Would it be cheaper than just getting dental work done in the US? Especially if you don't have a great dental insurance or any insurance at all. Sounds pretty good, right? Let's do some math here. Here's a rough breakdown. Round trip flight from LA to Shanghai, that's $1,000. Could be cheaper. 4 nights at hotel, that's $200. Daily transportation for 5 days, that's about $50. Food, $20 a day for 5 days, that's $100. Attraction tickets, that's about $50. Dental work, let's say for 1 tooth, root canal plus filling plus crown, it's about $347. The total cost is about $1,747. Just so you know, I'm using the prices from West China Hospital of Stomatology, which is top 1 dental hospital in China, and it ranks in the top 3 globally. Prices at other dental clinics could be up to 50% cheaper. If you are curious, you can do the math yourself. Feel free to ask any questions below. I'm sure the Chinese users and I would be happy to help answer them. 欢迎国内的朋友们评论指正。Please leave your comments. Please follow me or join the group chat for more updates and live stream from China. Thank you.
In China, people have social insurance, not private insurance. This means you don't need to pay high fees like private insurance, but you can still get many benefits. If you go to a hospital, insurance can cover a big part of the cost. In Shenzhen, Chinese people need surgery and stay in the hospital. Insurance can cover up to 90% of the cost, based on my friend's experience. In Shanghai, if I book a doctor's appointment without insurance, it costs 25 yuan, but with insurance, it only 6 yuan, just based on my own experience. You can see a doctor on the same day. Normal appointments are usually available, but extra doctors may need booking in advance. Different hospitals and cities have different insurance coverage, but most people get 15% to 90% of that cost covered. Social insurance includes 5 times insurance and a housing fund, pension, medical, unemployment, work injury, and maternity insurance. The housing fund can help reduce your mortgage when buying a house. If you work for a company, your employer pays a big part of your social insurance. Besides that, people in rural areas and self-employed workers can also pay for government health insurance. This makes seeing a doctor much cheaper than paying everything by yourself. And more medicines are included in the plan. The government's goal is to make sure everyone can get medical care. Eva, follow me to learn more about China. If you have any questions about China, ask me in the comments.
Why healthcare in China is significantly more affordable than in the United States? Let's take a closer look with a few examples. Take dental surgery, for instance. In the States, the cost of simple tooth extraction or root canal can easily run to hundreds or even thousands of dollars, depending on the procedures. In China, however, the same dental service could cost a fraction of that price. While still maintaining high standards of care, Chinese dental clinics often combine advanced technology with traditional methods, which not only lower costs, but also improves the overall treatment experience. When it comes to major surgeries, such as heart surgery, the cost difference is even more noticeable. In the States, coronary artery bypass surgery could cost anywhere from $100,000 to $200,000 or more. In China, the same procedure performed with state-of-the-art facilities and skilled professionals could cost as little as a fraction of that, while still offering world-class care. Additionally, China's integrity system blends Western medicine with traditional Chinese medicine, like acupuncture and herbal medicine, which could lead to faster recovery and a holistic approach to healing. As a non-profit organization, we offer special discounts for international patients who are seeking affordable, high-quality healthcare options in China. Whether you are looking for dental work, a major surgery, or simply want to experience the benefits of Chinese medicine alongside modern treatments, we're here to help you navigate your medical treatment and medical travel with ease, save a substantial amount of money, experience the rich cultural aspects of healthcare in China, and enjoy the combined benefits of East and West in your treatment. So reach out to us for more details on how we can help you embark on your medical journey with more savings and better outcomes. Thank you.
Hello, everyone. This is Andy, and I just got on the bus to head over to a local hospital to get some tests done and to see a doctor. I got on the bus. It was only 2 won, which is the equivalent of 27 cents. 27 cents to take me 6 bus stops to the hospital. Look at how clean this bus is. Super clean. The seats are clean, the bus is clean, it's modern. It's got every stop is like automated. And then you get on the bus and you've got a USB port if you need to charge your phone. Taking the bus in China is really, really nice.
Many of the Westerners are wondering why the healthcare and transportation in China is so cheap. It's like 1/10 of your cost. Let me explain it to you how the industries are structuralized in China. So to understand this, here is a pyramid. So on the top, it's the lifeblood industries. We call it level 1. So when we say lifeblood, it means that it's the strongest relevance to people's livelihood, such as foodstuff, healthcare, education, telecommunication, transportation, etc. These fields can only be invested or managed by state-owned enterprises. In level 1, no private capitals are allowed, because once you release it to private capitals, let's say healthcare, once you release healthcare to private capitals, on day 2, people will have to pay $2,000 calling for one ambulance, just like the United States, and that's just inhuman. So these fields have to be under control. As a matter of fact, many of the SOEs are facing a huge loss, and that is normal because the government wants them to have their products or services to the people in a very low price. So where does the money come from? The government's budget. Yeah, and of course, there are some fields that SOEs having a very high profit, such as tobaccos and oil companies. So once that have high profit and once they are having a loss, they can compensate with each other under the government's supervision. On the bottom of the pyramid is level 3, where all of the companies are invested by private capitals. SOEs are not involved with level 3 because the fields are not that lifebloody. So we can even say that fields like, clothes or furniture or retail sectors, we can even say that it's okay if these industries will have a shortage or oversupply because it won't lead to a financial crisis. And the level in between is level 2. It has a medium effect on people's livelihood and medium technology and capital barrier. So I'm talking about cars or ships, logistics, civil construction, media, and insurance companies. So it's kind of like a mixture between SOEs and private companies. Listen, it's been a cliche that SOEs are low efficient and they are causing corruptions. Let's look at level 2. SOEs and private companies are competing with each other in so many fields. So it is not responsible to give such a bold judgment. And as a matter of fact, people work in SOEs, they work very hard and they suffer from high pressure. So do you see? It's not a problem about the system itself. It's all about whether the system is delicately designed and whether the policies are well executed.
My wife has given birth here in the Chinese hospital. It's a private Chinese hospital and it's amazing. The staff are amazing. The service is amazing. The food is great. We actually had an experience in Australia, my home country, and we were in the private system. We had a private OBGYN, obstetrician gynecologist, who's a specialist in helping women give birth. We had our first son in Australia, and now we've had our second here in China. Now let me give you a bit of a glimpse of our room here in the private hospital in Chengdu in China. It's a massive room, huge. We have a lot of space. That's a spare bed, like a living room, a dining area here. This is my wife's food. She's currently asleep. Nice vegetables and meat. This is all freshly cooked today. They take extra special care for the mums to make sure they're getting very highly nutritious food so that they can breastfeed the babies. And for the dads, the husbands, we get a meal too. It's not as fancy, but it's still 3 meals a day. So I get 3 meals a day. I eat a lot here at this hospital. It's amazing. My wife and my son are in here. It's a baby crib. That's another spare bed. Here's my wife here. And my little darling over here. And I've just got my wife a nice drink that she'll like when she wakes up. So I'll take this over. I can just put this over here. It's very warm in here right now. It's it's not minus degrees outside. It's 2 degrees outside right now. And it's super warm in here, super warm. So I'm gonna have my meal now. I'm gonna enjoy that. So all I can say is this is an awesome experience here. In Australia, my wife gave birth to our first son, and there was quite a bit of, I would say, negligence on the part of our OBGYN, our obstetrician gynecologist in Australia. She had to get an emergency cesarean in Australia with our first son because of the negligence of the OBGYN. The baby was huge. He was 4.157 kilograms, which is 9.5 pounds. She didn't really help or ascertain how dilated my wife was. My wife started pushing, the cervix swelled and needed an emergency cesarean. So that was a really bad experience for us. She went into contractions at about 10 p.m. last night. We came into the hospital at about 2:30. Our doula came to our house, helped Shu through the breathing and making sure that she's dilating well and progressing well before we come into the hospital. Came into the hospital, Shu was pretty much completely dilated. Here, natural birth, no pain medication, no tearing, no IV, absolutely mind-blowing. They don't force us to take vaccinations at birth, you know, for the baby. Great food, great people, and we're going to be here for a couple of days, and I'll document our experience as we go. So far, it's absolutely amazing.
The World Health Organization calls China's system a public health miracle, and I agree. So a village doctor in China crosses mountains to vaccinate people, whilst an ambulance ride in America costs $3,000. China negotiates the world's lowest cancer drug prices, whilst insulin prices in other countries have skyrocketed 10 times the value in 20 years. The average hospitalization cost in China is 1/5 of that in the US. China's life expectancy now exceeds the US. 5G remote surgeries in China saves lives in Tibet, whilst UK patients have to wait 2 years just for basic surgeries. So as I say, the World Health Organization calls China's system a public health miracle, using just 9% of the world's medical resources to care for 20% of the world's population. So, should healthcare be something everyone can afford, or should people have to pay high prices just to stay alive? Can other countries learn from China's system? Personally, I think so. But let me know what your opinions are, guys. Take care for now. Hope you enjoyed today's video, and I shall see you all in the next one. Bye-bye for now. Bye-bye.
Ni hao, friends. I heard that in China, you take care of your parents. Here in America, most families put their parents in a nursing home. We didn't have a choice because my mom fell, and now she's not allowed to go home. I am not allowed to take her away unless I get permission from the facility. It's heartbreaking. I only get to come and see her a few times a week because I work. I didn't really have a choice in the matter because my older siblings are power of attorney and decided that we cannot take care of her at home. So I am curious if you take care of your parents in home, or if China has a facility where elderly people have to stay. Come along with me. I'm going to show you the inside of a nursing facility here in America. And this is her room.